It's indeed a privilege to be partnering with today's event. As a matter of fact, one could see that the FAO International Conference on Nutrition declared in December 1992 that access to nutritionally adequate safe food is a right of each individual, the language which we hear from the courts nowadays. Thus, it's in the fitness of things that the theme for the WHO Day, 7th April, preponed to 1st of April on celebration counts, is food safety with the theme of food, farm to plate, and safe food. As the national regulator, the Food Safety and Standards Authority of India has been mandated to ensure safe and wholesome food in the country. It's understood that we touch upon 5 themes in this process, which are common to any and every regulatory regime. The first, and perhaps the most important, is related to ensuring safe food for the health of consumers. The second is evidence-based standard setting. Third, enabling and allowing consumers to make informed choices. Fourth, shared responsibility of all the stakeholders in implementing a regulatory regime. And fifth, if I may add, that the food regulatory regime is a very complex area and not at all an easy ride. These 5 common themes can be juxtaposed against the Food Safety and Standards Act 2006, when India decided to bring in one consolidated law to regulate the food sector as against multiplicity of laws and orders prior to that. Having come out with the Act in 2006, the authority was established in 2008, and it really started functioning from August 2011. And to that extent, it's a rather new organization, almost getting on to the walking stage. The FSS Act is a federal act passed by the Parliament, but the enforcement of law remains largely in the domain of all the states and the union territories. And that makes the task a bit more challenging, but clearly spelling out that centrally the authority's role gets more pronounced in terms of standard setting, in terms of policy, regulatory regime, or creating that framework, and passing the burden for enforcement onto the constituent states with that kind of diversity this huge country has. During the course of this journey from the farm to the plate, I was just mentioning that so far FSSAI is out of that jurisdiction as long as it is on the farm. That is, if you have a fruit hanging on a tree, it's outside FSSAI's scope. The moment it falls down and can be used as food, FSSAI steps in. A very delicate boundary. But this whole journey, right from growing, processing, storage, transportation, and marketing, has the risks and challenges of contamination, adulteration from toxic and low quality substances. It can also be experienced at the household level in case we don't practice the all-time important hygienic practices. Moreover, as our food supply becomes increasingly globalized, newer challenges and threats are constantly emerging. As the volume of international trade expands, so do the opportunities for transmitting pathogens or chemical contamination from one part of the world to the another. To manage the risk adequately, interventions have to be implemented at every point of food supply chain, from production to processing to distribution to warehousing to retailing, and in the hands of the consumer at the end. In the last 4 or 5 functional years that FSSAI has been, it has taken important steps. As a matter of fact, by 2011, 6 major regulations had already been notified before these were put into practice. We have gone through a huge exercise in terms of harmonization of additive standards aligned with international practices, more so with Codex, and we should be shortly seeing that getting into the legal framework, the legal space of the food regulatory regime. The authority has a scientific committee comprising of distinguished food scientists and experts. We have already about 9 scientific panels and are planning to have another 12 panels to develop, to review our existing standards as well as develop more and more vertical standards so that the deviations are minimal, though technology advances would always keep pace as we try to bridge this gap as ever. In terms of licensing and registration, I really don't know, in a country of 125 crores, where should we put the number of food business operators? It's a guesstimate. One safe guesstimate, they say, is 2% of it constitutes the people who are in the food business. Then that itself comes to close to about 2.5 crores, against which we have right now 19,000 central licenses and a total of close to 3.3 million registrations and state licenses. There is a wide gap which needs to be covered, and we are looking at it how to facilitate so as to bring all the food business operators within the registry, not for the purposes of a license, Raj, but as a census of all the FBOs, most importantly, in order to keep the traceability issues intact. A robust food testing laboratory infrastructure holds the key to ensuring safety of food as well as giving that confidence to the consumer that he can have an access to a laboratory infrastructure and get the food tested. This is an area where we have to cover a lot of ground. Recognizing that the state or public food testing laboratories offer a lot of gap to be bridged in terms of capacity and capability, the FSSAI took upon itself to enlist the support from the private sector, and were notified 64 NABL accredited laboratories already. In addition, there are another 14 laboratories which are in the process of being notified shortly. As a matter of fact, yesterday we sent the notification to the controller of publications. But since the health secretary is also here, I would seek his attention. We need to, sir, really strengthen the laboratory infrastructure in the states. The centrally sponsored scheme as it was proposed, probably it's high time that we take it to a logical end in order to create this facility and make it available to the consumers at large as well as to the food industry. As against 377 standards, which we believe cater to 90% of the volume of food consumed in India, and close to 11,000 additive standards harmonization process having been completed. Now we are getting on to the job of bringing in more and more vertical standards. Those standard setting takes its own time. One of the major limitations in the Indian context being that we have yet to really get into the sensitivity of data collection, data aggregation in order to take scientific evidence-based decisions. Sir, Dr. Manapte touched upon the street food vendors. As a matter of fact, this is one area where we look at it that a good percentage of fresh food is being sold, a good part of it, by the street food vendors in major towns and smaller towns adjoining those areas. We have taken the initiative. As a matter of fact, thanks to the Department of Consumer Affairs, Mr. Keshav Deshiraju is there. We are taking it up jointly to work on the improvement of conditions of the street food vendors. But the first mover will have to be in the states through the Department of Urban Local Bodies in order to identify and develop the basic infrastructure for the working conditions and environment of those concentrations where street food vendors can be placed on those platforms. Sir, adequate and suitable infrastructure in terms of human resources and physical infrastructure at all levels would need to be put in place to achieve the objectives of the Food Authority. We are working for it. As a matter of fact, I must thank Mr. B.P. Sharma yesterday alone. He virtually gave a carte blanche. He said, go ahead and put together the best resources that you can get in order to support the FSSAI.